Good afternoon and welcome to our continuing New Hampshire COVID-19 Vaccine Alliance meetings. We've been doing these meetings since mid-December, and we thank you for your participation. This week, we're going to recap some of the information from the previous week. Two, we're going to give you an example of a collaborative activity we mentioned last week. And third, we have kind of late-breaking information about the transition from the public-dominated vaccine allocation process to a private one. So you'll want to stay on board and be ready for that. So again, for anyone who's new, the mission here is to convene stakeholders across the Granite State to promote vaccine confidence, support accurate and consistent vaccine information, and coordinate the vaccines, help coordinate the vaccines allocation program. We do this by promoting public buy-in to increase New Hampshire immunization rates, most importantly, as a force multiplier to support the state's communication and allocation plans. Third, we counter misinformation whenever needed. And fourth, we try to foster use of New Hampshire's immunization information system. Next slide, please. So again, here are our sponsors. Thank you to them: Harvard Pilgrim, Anthem, Dare Medical Center, Convenient MD, Wilson Health Plans, and New Hampshire Healthy Families Health Plans. Next slide. Two takeaways. One, last week, if you missed it, we had a panel discussion from three attorneys, Ken Bartholomew, Robert Bess, and Lucy Hodder, on legal issues requiring or incentivizing COVID-19 vaccines. If you didn't get to see that, you can go to the website, our website, and look under news for March 31st Vaccine Alliance meeting. And you can get the slide decks and see the video of that presentation. Other big change has to do with phase 3 is including 16, 17-year-olds. And the four major points is of course, register on VINI. And they only qualify for the Pfizer vaccine. So those Pfizer vaccines are available at all state-managed fixed sites, Walgreens and North Country Health, Littleton Regional, Huggins Memorial, and LRGH hospitals. Parents must accompany the minor, 16 or 17-year-old, and the minor has to bring either a driver's license, or if they have a non-driver's ID, they bring also birth certificate or passport information. Next slide, please. Just a reminder that currently they're transitioning from the old VaccineH ordering site to the new NHIIS that will reopen, scheduled to reopen on the 15th, has these things. If you're not familiar with it, please, those are the websites, and we will provide this slide deck after this afternoon to the presentation if you know that, if you don't already know that. Next slide, please. Here is some of the critical information from there. The big thing is they're under the transition currently to reopen on the 15th. And so if you need any emergency ordering done, it's done by case, and you can fax those in to the division. Also, vaccine orders are being moved from VAMS into the new system, which will include ordering, internal transfers, reconciliation within NHIIS. Next slide, please. Most importantly, make sure now's the time to make sure that everyone who's going to be using the new NHIIS, that they have to complete a 30-minute web-based module training, and they have to pass that with a score, and then you have to send in the certificate, so you'll be qualified to use the system. So most important is the link to the training, which is https://www.train.org/cdctrain. Next slide. All right, so we thought we'd bring to you a collaborative site example, and I'm hoping that Patty, we have found Patty Crooker. So I wanted to give you a little bit of background on our guest. This is a collaboration between the Greater Nashville Public Health Network Services and Fidelity Investments. We have two presenters today. Patty Crooker, I'm sorry, it's Crooker. I spelled that wrong. It should be an R in there. MPH. She is a public health services coordinator for the last 13 years for the city of Nashville as part of the Greater Nashville Public Health Services Network Services. She earned her master's degree in public health and management from the University of New Hampshire, and also attended her bachelor's there, as well as certification in public health and certified in public health emergency professionals, or CHEP. Joe Murray has been with Fidelity Investments for now 14 years, I think it is, Joe. He serves as Vice President of Public Affairs at their Merrimack, New Hampshire campus. For I think it's still, is it over 5,000 employees? It might be greater than that now. More than 1 million square feet of office space, from what I'm told, and 8 miles of walking trails. So you have a bit of a mini campus of any university would be probably proud of there. Prior to Fidelity, Joe was managing editor at WMUR and also served for 15 years as a producer for the Boston stations of Channel 5, WCVB, and Channel 7. Joe received his bachelor's in communications from Ithaca College. And I always have to ask Joe, do you say go Bombers or do you say go Cayugas? Big debate that I always ask that. of a friend who was in graduate school. So we'd have this debate. And Cayugas, I'd always tell him, are actually the indigenous people of upstate New York, known as people of the Great Swamp. And so I would always tease him and say, does that mean that you are students of the Great Swamp? So, but I'm assuming it's still Bombers. Isn't that the nickname that they use pretty much?
Yeah, and for those who don't like the term Bombers, color is blue, so go blue. That works as well. And as a Syracuse, New York native, I'm a proud native of the swamp. So great to see you, Jen.
All right. Well, thanks, Joe. I think we're still looking for Patty, unless Patty is on. If you can identify yourself, Patty, by either raising your hand or identifying yourself to us. I have a couple call-ins, but I am not seeing Patty right now. So I will try to raise her. But Joe, why don't you give us a little bit of an overview of the collaborative activity that you've been doing with the Regional Public Health Network there in Nashville?
Sure. Thanks, Jim. And I know Patty had a clinic this morning, so her timing was tight. She wasn't positive if she was going to make it right at the top of the hour. So like everyone in the healthcare field, it's a little busy these days. So I'll just share our experience, and if Patty joins us, great. She can certainly add to it, because this really has been a partnership from the start, and to this point, just a great one. So at really the beginning of this year, Fidelity made pretty much an open offer to state and local public health officials. We offered a number of things. We offered our, with the vaccination effort ramping up, we offered our planning and operational capabilities, our technology expertise. We're in Merrimack, we're a technology company as much as we are a financial services company. And most importantly, as Jim referred to, we offered our space. and our location, which is conveniently right off of the Everett Turnpike, exit 10. Easy in, easy out, a lot of space on campus, both for the vaccination space and to get in and out of our campus. So that's what led to our partnership with the Nashua Department of Public Health and Community Services. We decided to basically provide what turned out to be, and I'll show you in a moment, hopefully, a 10,000 square foot tent in one of our parking lots, and it's still up there waiting for more activity. Let me try and share the screen here. Just have a few photos. Jim, can you see that?
Not yet. Brian, does he have access?
He does, yeah. If you just click on the green screen share screen button, you should be all set. Thank you.
Yeah, let me try that again. There we go. Is that coming up now?
It is, thank you.
Okay. Great. So here's a shot that was taken on March 27th. We had a weekend clinic at Fidelity. This is a parking lot. To the right of the tent is a big parking garage where people could park and just essentially walk or be helped into the tent. This is the entrance area. For this clinic, over 2 days, we held clinics from 9 until 5, and then on Sunday from 9 until 2, we were able to get almost 2,600 people vaccinated. These are folks who live within the Nashua Public Health region. That's Nashua and I think 12 towns in the surrounding area. This is first dose clinic, so these folks we will be having back to our site on April 24th and 25th for their second dose of the Moderna vaccine. What was, and I'll move along here too. Here's a shot. You couldn't really see the scope of the facility from that first picture, but this is after you came through registration and corridor. This is where the vaccinations were delivered. And if you look in the background toward the end of the tent, so we had about 20 vaccinations stations set up. And in front of that, 80 to 90 chairs set up, socially distant, of course, for observation. So there was a kind of front to back flow that worked terrifically for people. And then when they left the tent, there was an entrance to get them back into the garage and depart campus. I do have here a very quick video that gives you another sense. So what was specifically pleasing to Fidelity was that there were hundreds of teachers and childcare workers vaccinated from those towns that the Nashua region covers. Also a win for us, we were able to engage about 75 of our own associates, Fidelity employees, who were able to volunteer on a number of tasks from Friday through Sunday, everything from stocking bins to data entry and just support for the staff for whatever they needed. They were thrilled to be able to see some of their colleagues. It really, I get, you know, what I took away from this was what I've heard at different other vaccination clinics around the country is just this general sense of joy and accomplishment from the extraordinary work that the public health staff did, endless labor to get to pull this off, to what our volunteers were able to do, and just the collegial spirit that existed. Just briefly, and I'll stop sharing the screen here if I can. There we Joe. So from a planning perspective, kind of how we got there, this was definitely not an easy task. It involved daily planning sessions between Fidelity and the folks from Nashua, multiple departments on both ends, and really an extraordinary effort. Again, cooperation. What it took is just a kind of joint vision and commitment to pull this off. And we're hoping, actually just today we confirmed another clinic for next Wednesday, April 14th. Our intention is to be there for additional clinics as needed. The facility is there. We're committed to keeping it up, and hopefully we'll get the most use out of it that we can. So I'll leave it at that. I'm not sure if Patty was able to join at all, but happy to answer questions.
Thanks, Joe. We'll take any questions that you might have on this. But Joe, what were, I guess, going into this, what were some of the lessons learned? What were things that you didn't necessarily anticipate that you kind of learned through this process?
Yep. I'll tell you, there were no major problems that we had, and I'll chalk that up to the Department of Public Health in Nashua, and give a shout to our teams. And we had our real estate, security, meeting and event staff. Keep in mind that most of our campus is empty, and our meeting and events staff hasn't had a heck of a lot to do over the past year. They were thrilled to have this work in front of them. But we did have daily, at least a half-hour meeting every day for maybe 2 weeks leading up to this date. And we kind of opened up the campus in advance and had the tent set up by the middle of the week before the weekend. So everything was good to go Saturday morning. And the Nashua team actually has a trailer on our site there for, obviously not the vaccine, but for supplies that are needed. So we can ramp right back up, at a moment's notice, basically. So we'll be good to go again next Wednesday. Again, I would say it was really from upfront is just a commitment to, do what we can to help. We wish we could do more of this because, we have the tent up, but it obviously is a complicated effort. We're limited by supply, clearly, and so we'll continue as warranted.
Great, and I guess the follow-up question, you kind of touched upon this a little bit, but going forward, what do you anticipate? Are you going to keep the tent up? Is it dependent on supply and how things shift?
Yeah, so we're certainly committed through the second dose for the folks who got their vaccine last month. But our hope is that, if it's weekly, great. Really, we truly have said, based on the need, we can keep that up and running. We Fidelity believe in the efficacy of the vaccines. Obviously, we've communicated that to our associates. So we certainly believe that the quickest path to whatever normal we're going to have, hopefully in a few months, the quickest path is getting shots in arms, as they say. And, we're just thrilled to kind of have the resources and the capacity and the leadership within our company to raise our hand. So,
well, Joe, on behalf of the Alliance and our partners, as well, I'm sure, as the Division of Public Health and those at the Greater Nashua Regional Public Health Network, thank you very much for Fidelity's willing to step up and help serve in this capacity. And we look forward to hearing more in the new future. So again, Joe, thanks for participating and sharing a little bit of what you all have been able to pull off. Thank you.
Yeah, and I'll just make mention. I'm sorry that Patty wasn't able to make it or can't chime in from where she is, but Patty Crooker, Mike Apollo, Jen Swabowitz, Bobby Bagley, all folks from Nashua Public Health who, really shared our vision and honestly enthusiasm. Just terrific people who just want to get this done. And, on a personal level, it's been a great experience for a number of people at Fidelity to be able to pull this off.
Again, thanks very much, Joe. Appreciate your time and commitment by Fidelity to help expand the COVID vaccine effort across the state. So again, thanks. Brian, I'd like to shift now, if we can, to the second slide deck that I have. And I have some late-breaking information I think you're all going to be interested in. Next slide, please. And it's the transitioning actually from public to private COVID vaccine allocation in New Hampshire. So first, the vaccine supply and the phase 3 numbers are really driving the shift at this point. The state literally wants to get out of the business of what they're doing for a couple of reasons. First, I think the commitment of the Guard. They've been working for the better part of a year in various capacities, and so I think they'd like to be able to send them home. Other is the relation that the amount of vaccine that's going to be needed or produced is not going to require the big mass sites. So I think what we're going to be seeing here, and what we're going to talk a little bit about, is that transition process from a public-dominated or a state-dominated allocation process to more of a private one in the next few weeks. So as many of you know, participated, the HHS sent out last week a survey inquiring a number of factors on this shift in allocation strategy. And next. So to begin with, next week, all pharmacies in the state who have signed a provider agreement will be expanding under the federal program. So the federal program is expanding its allocation of vaccine as they're moving forward in this process. The one thing I would say about this, and I think it only applies to one national pharmacy, we're going to, on behalf of the medical society, we're going to encourage all the pharmacies to participate in the state systems for tracking this information. It's most important. Next, in the next 2 to 3 weeks, then those organizations, facilities who said that they wanted to expand open pod systems, that is likely to occur in the next 2 to 3 weeks. And so we'll talk a little bit more about preparation for that. But best information I have, and again, this can slide by a week or two, depending on a couple different factors moving. But in the next 3 to 5 weeks, and I think we're going to be moving to the closed pod expansion. So again, just kind of a recap. Next week, it's anticipated that with expansion of the federal program, all pharmacies in the state will be getting allocations of the COVID-19 vaccine. And we're urging all those pharmacies to participate in the state's information systems. Oh, can you go back a couple? Sorry. There we go. Again, and then 2 to 3 weeks, the open or public pod expansion, 3 to 5 weeks, the closed pod. So next week, we have a commitment from the department to have a speaker outline specifically and more formally the transition of this allocation process from public to private. So you want to tune in next week. We'll hopefully have a little bit bigger audience to kind of hear that information as it's moving forward. I will tell you, it's my understanding too, that the hospital CEOs will have a briefing specifically either late this week or early next week, just prior to our Tuesday call. Next, so it's it's time to start preparing. And one never has enough time to prepare. But a couple of things we're asking everyone to make sure that they're signed up and have staff trained on the NHIIS system. Two, review those system workflows as they're moving forward. There's information both on the vaccine information site and CDC websites on protocols and preparing for that. Third, we're going to encourage you to also have vaccine FAQs and other information available for your patients, or if it's a public site, having that information. The big challenge, I think, right now is the easy part is done. There's going to be done. And that, what we're seeing is everyone who wanted a vaccine can get one. The tough problem, and I think this is going to fall to more of a private response, is those who are initially hesitant. My guess is this will start again in the next few weeks, and we'll go over the summer, and we'll have to help work with the state. And this is where we're going to need all the stakeholders to really help root out where the hesitant populations are and make sure that their questions are answered to really hopefully drive up the overall immunization rate so we reach close to herd immunity moving forward. So there's also the other part is vaccine messaging and promotion. Just be aware that the vaccine information site, that site for the department is all changed around. So if you can't find anything immediately, look under the menu and you'll probably be able to locate some of the sites that you saw before. But there has been a reorganization there, and when you pick it up, it's a little bit discerning, but you can find all the same information there that was there previously. The second thing, we participated last week with Vice President Harris and the COVID community corps program that was launched. And that information can be found under wecandothis.hhs.gov. It's a brand new website that was just launched. It has a lot of resources. There's one information here by the Ad Council that also has a lot more campaign information, and we'll make that available afterwards. And also our Mask Up New Hampshire site, and we have a section that's dedicated to COVID-19. So those are all good sites for information on messaging and promotion of the vaccine as we transition from, again, a state kind of dominated system to a private response in vaccine allocation. So at this point, I'm happy to talk and address some of the questions that we have online. We have one question: when is this transition likely to happen? Well, it's going to start happening next week with the expansion of the federal programs. And then I think, again, it's more of a numbers game. It's when will there be adequate vaccine available supply to get the second doses and first doses of phase 3 completed. And I believe the state has appointments up through the first week in June available. But from what I'm hearing, there has been less of a response by individuals in phase 3 than was first anticipated. So we think that that the timetable could start to begin to shift up. But it'll be at the time that the state feels comfortable that it has enough vaccine available to start sharing with essentially private sites beyond as part of their allocation, not as part of the federal allocation. That's the closest we will be able to determine. And again, we'll have an individual or some individuals from the department in next week to give some more specifics around the program. Second question: do you know how the change from public to private distribution will affect the public network distributions to harder reach communities? That's a great question. Keep in mind, as part of this overall program, there is still will be maintained a 10% set aside for the equity outreach portion of the program. So that will continue as long as the public health networks have the capacity to do that, the volunteers and their missions. So those missions will continue, I anticipate, as they're moving on, particularly with second doses to the school faculty and staff across the state from K through 12. I also know that students who are essentially in-state or residents of New Hampshire are beginning to get vaccines on college campuses. The policy decision to allow it to others has not been made. And at this point, it's difficult to tell if there will be time to actually get first and second doses to that population. So at this point, I don't think we're necessarily counting on that expansion of policy. But I think the focus will be on this transition as demand for the public sites begins to wane here, probably over the better part of the next month or so. And so those are a couple updates. We'll have more specific information from the department as it becomes available. But plan on being here next week to learn some of the specifics behind that and what you and either your practices or your partners need to know on this. There is a question for Joe. Joe, if you're still there. I'm looking for that question.
Hi, Jim. I do see a question from Dr. Gassert. How does one register for the Fidelity Nashua community clinics going forward? I would advise people to contact specifically Patty Crooker at the Nashua Department of Public Health and Community Services, or another contact would be Bobby Bagley, who I believe heads up the department. They could tell you the sign-up process was a little quirky necessarily because for the first clinic, we're originally dealing directly with school districts, but in order to get a critical mass, we also opened it up to the 50+ population to ensure that we were filled up. But in terms of we're not managing, we're really just providing the space and the services. But Nashua Public Health can help with logistics.
Right, and that's pretty much what we've said. You can go to NH Responds and sign up there. But as much we've encouraged individuals who want to assist with any of the regional public health networks, that they contact them directly, and that's probably the most assured way to get that. But they are taking names from those volunteer sites, and we'll republish that information in some of our publications coming up, and with this slide deck too, as we publish it. So thank you for that question. So I'm not seeing any further questions right now, but I'd ask you to please be on the watch next week and participate, encourage others who may be interested in learning more about this transition process from the state to a private allocation process. So thank you again, Joe, for your participation today. Thank you for everyone who joined us, and we'll look forward to seeing you next week, next Tuesday at noon. Take care, everyone.